Thanks, Colin. I'm just basically going to reiterate a few brief points on what I said earlier today. And it's really about the services. The biggest critical problem for us at the moment, the clinic genetic service, is the fact that we have very few consultants, and the standard waiting time is about 2.5 to 3 years for routine referrals. And the HSE has recognised this, and so they've specifically put funding in place to fund an additional consultant who is going to be somebody who is going to be seeing the fetal valproate people on a separate stream at a shorter notice from those on a regular waiting list, without compromising those people on the regular waiting list. And the second thing the HSE has also done is appointed a paediatrician specifically for dealing with children, not adults, but children who have suspected fetal valproate syndrome, both to try and make sure they have developmental assessments and appropriate assessments. And Dr. Epilim, who was here this morning, has already been doing clinics since November, seeing children with fetal valproate syndrome, and that's alternate Friday afternoons. In terms of people who've been referred, I noticed that obviously Cora identified a number of people who, through the phone calls, who'd actually been had a suspected member of the family with the fetal valproate syndrome. Not all of those necessarily have come to be referred to us yet, and that's through primary care. So for people where there are concerns, they can get a referral from the GP to Dr. Epilim, and again, you don't have to be a Crumlin patient or a Crumlin catchment area. That's a national service for the assessment from Dr. Epilim's clinic for children, to make sure they have the appropriate services and their structures are set up for them anyway. And then if Dr. Epilim is concerned, those children then referred on to the genetics clinic, and then we will see them, the children. But also if there's an adult, because Crumlin in general doesn't see anybody over the age of 16, but the genetic service is specifically meant for both adults and children, and we can then take referrals directly of adults with suspected fetal valproate syndrome. We've only had 2 so far, so the most referrals that we've had have been to children to date. As I've said before, in terms of going through the clinic, we go through an assessment of the diagnostic pathway, looking at histories, pregnancy history, family history, obviously dose, anticonvulsant therapy and so on, growth and developmental progress, family history, reviewing the old pictures of people, which can often be helpful in older children to see whether they have signs of the condition, and a careful examination to make an exclusion. And again, to re-emphasise that both what Peter and I have said before, is that there isn't one pathognomonic test or clinical sign that says you definitely have fetal valproate syndrome. It's a constellation of features, and it's also an exclusion of other conditions that might explain that. So that would be by other chromosome testing, and if there is a suspicion of an alternative diagnosis, testing for that specific condition, or else potentially in addition testing for a range of other conditions that can cause developmental disorders the next zone, and then review them. So the process of that would probably take between around 4 months from the genetics view, when you add in the timing for genetic testing that's being carried out, and then people will be reviewed at the end, and they'll be given a diagnosis confirmed, potentially an alternative diagnosis. And potentially there'll be a small number where there may be a diagnosis uncertain. And I've already been linking with with the UK groups, particularly Jill, to see that we'll be using similar patterns and similar assessments, and potentially may have situations where you can get second opinions on people if there is a doubt about a diagnosis or a particular feature. And of course, it's important to remember that not every child who has been exposed to valproate in pregnancy is actually going to be affected. So there are people who have been on valproate who have perfectly healthy children, and it's important that can be done as reassurance as well. It's not always the case, but obviously there's a concern that goes on with that. So that's the pathway, and that's new. That hasn't been something that we had at summertime, so there's been investment from the HSE to help that, and I appreciate there's a number of you waiting to be seen because we haven't got that extra consultant person in place yet, but as soon as they are, then that clinic is going to be running. Okay, thank you.